For thoracic outlet syndrome, or TOS, the most commonly performed tests include the Adson's Vascular Test, the Pectoralis Minor Test, also known as the Modified Wright Test, and the Costoclavicular Maneuver. The reliability of these tests has yet to be determined. However, the specificity has been reported at 18 to 87%, and the sensitivity has been reported at 94%. The first test I'm going to demonstrate will be the Adson's Vascular Test. With this test, you'll ask your patient to be seated on the table with their arms at their side. You're first going to assess the patient's radial pulse. You may want to assess this for up to 1 minute. After 1 minute, you're going to ask your patient to inhale deeply and hold their breath, and then extend their neck back and rotate it to the side that's being tested. So your head will rotate this way. You'll assess the radial pulse. For a positive test, there will be a change in pulse or a reproduction of the patient's symptoms. If the test is positive, this indicates that the scaling is the primary cause of the symptoms. The next test I'm going to demonstrate is going to be Allen's Pectoralis Minor Test, or the Modified Wright Test. Once again, the patient's going to be seated with their arms at their side. You're going to palpate the radial pulse and assess it. Once again, you may want to assess this for up to 1 minute. After 1 minute, the patient's shoulder will be placed in 90 degrees abduction, 90 degrees elbow flexion, and 90 degrees external rotation. You're going to ask the patient to rotate their head to the opposite side. Once again, you'll palpate the pulse and assess for any changes. A positive test would be a change in pulse or reproduction of patient's symptoms. This test, if positive, indicates tightness of the pectoralis minor. The last test is the Costoclavicular test. With this test, you'll palpate the radial pulse. Once again, you may want to assess this for 1 minute. After 1 minute, you're going to ask the patient to retract their shoulder and depress it while protruding their chest. You can assess this position for 1 minute. Once again, a positive test would be a change in pulse or a reproduction of the patient's symptoms. If there's a change in pulse, this indicates that the symptoms are due to a vascular origin. However, in 50% of normal asymptomatic patients, the pulse has changed. Therefore, it would be better to have a reproduction of the patient's symptoms in order to be a true indicator of TOS. Thank you.